Hey everyone, it's Dr. Hodges, and today I'm going on a walk with little Pippi. Oh, little Pippi. There's my doggy bag. I'm looking for a trash can. There's one right up here by the park. It's kind of stinky. Anyway, I digress. Today, I want to share some great kind of exciting news that came out of ASMBS, that's our Bariatric Society, our annual meeting this past summer. So, do you guys want to know what can offer 5 times the weight loss compared to the GLP-1s? And that is looking at Mounjaro, Ozempic, Wegovy, semaglutide, Zepbound, tirzepatide, the whole shebang. You know what can offer 5 times the weight loss? Surgery, old tried and true. So I'm going to have another little video on kind of really how to dissect a study. But it was really exciting. This past summer, it was presented at our annual meeting that there was a study where they looked at 51,000 patients. That is a huge number for a study. That makes that study very powerful. And they were comparing patients that underwent sleeve and gastric bypass. Typically sleeves, you can lose about 65 pounds for every 100 pounds you're overweight. Bypass is going to be about 75 pounds for every 100 pounds you're overweight. They compared that weight loss to the weight loss that you would get from a GLP-1. And they follow those patients they actually follow the patients over the course of about 2.5 years. And the findings were very interesting. Number one, they saw on average, the patients with surgery were losing around 60 pounds, give or take 15 pounds more whenever you look at patients that, if you look at the absolute numbers for patients that underwent gastric bypass. So the surgery patients were losing roughly 60 some odd pounds. Now, then they looked at the GLP-1 users. When you looked at patients that were in a clinical trial, meaning the published data from the Wegovy people or from the Zepbound people, meaning patients that were on, if you look at their study design, they were only taking in 500 less calories and deficit, and they were also on a prescribed workout plan several times a week. In that perfect setting, patients were losing roughly 24 pounds in a 1-year period. So that's about 20%, which is what they have on all their commercials. However, what this study was also showing, when we looked at a much, much larger group of patients, because what I'll show in another video is that those studies that they have published on their website, it only includes about 250 to maybe 300 patients. What we were finding in our study that included 51,000 patients is that in real life, not in a clinical setting, but in real life, patients that go see a doctor, maybe they go see their primary care, maybe they go to a med spa, maybe they get it off of Noom, maybe they actually have a doctor that will provide nutritional counseling, maybe not. But this is just real world. What are we seeing? Patients are losing about 12, 15 pounds, about 12 pounds. That is the published data right now on a study that is much, much more powerful than what was presented to the FDA for Wegovy and Zepbound. So there was that. The other thing, so if you look at the amount of pure weight loss that somebody can have, comparing the two in real world, typically your surgery patients on average are losing 60 pounds, give or take another 10 to 15 pounds, compared to medication, and they're losing about 12 in real world. The other thing that was noted is that 70% of patients that start medication, within a year, they stop taking them. And, you know, if anybody has been following along on my channel, you'll know that I am always harping on patients and always kind of harping on the idea that obesity is a disease. It is a chronic disease. This is not a one and done. Even if you undergo surgery, you can't just have surgery and then wash your hands and say, okay, we're done, we got it done. That's not how it goes. It is something that you're always going to have to work towards. I always say, you know, if somebody has diabetes, you wouldn't just say, stop eating sugar. You would give them medication. You would give them a treatment to fix the organic cause, and then you would also address the behavioral side. Well, that's the same with surgery, and that's also what it should be if you're doing medical weight loss. You can take medication, or you can have surgery to help with the organic or metabolic things that are going on in your body, but then you also have to have that component of behavioral changes to make sure that you have good, long-lasting results. And it was such a powerful study because, to me, it showed a couple things. Number one, it showed us that by far, surgery is just a much more powerful tool in the fight against obesity. So you're going to lose more weight. We already have studies from 2015 that show that if you have weight loss surgery, your diabetes will go into remission, particularly if you've been treated for 8 years or less. If you have a duodenal switch or a gastric bypass, more than 80% of patients are going to be coming off all of those medicines, blood pressure medicine, diabetes medicine, that even includes insulin, when you leave the hospital. You don't get that if you just are on a weight loss diet. Even if you lose all your weight and you have diabetes, you will still be diabetic. Your diabetes will not be in remission, and you'll continue to take your medication. I think the other tricky thing whenever we're looking particularly at the disease of diabetes is that diabetes affects your metabolic pathways, the pathways that control digestion, that control how your body utilizes fats, how your body stores fats. And for the medications that we have in our arsenal to control your glucose, we are basically telling your body to store fat, because insulin is a hormone of storage. And fundamentally, when you have diabetes, you're going to be insulin resistant. So we are having to either give you insulin or give you medications to really make your, jack up the amount of insulin that you have in your body, so your body will actually respond to it. So, and insulin is hormone of storage. So you're basically telling your body, store, store, store. So what happens when you store more fat? You now become more insulin resistant. So you're like a dog chasing its tail. What comes first? You know, are you diabetic, insulin resistant? Now that causes more weight gain. Or were you already genetically predisposed? Now you're overweight, and now that kind of puts you into this cascade of diabetes. And so it's like this never-ending cycle. And so when I'm talking to my patients and I'm counseling them, particularly if I have a patient that maybe they never considered surgery, and maybe they were referred to me from the orthopedic surgeon. I get a lot of referrals from ortho, or they get a referral from a fertility specialist, or just a primary care doctor that they just don't specialize in weight loss. And they're like, gosh, you know, you have diabetes, you have high blood pressure, or maybe you're healthy. You don't have any chronic health problems other than the fact that you have a BMI that's over 35, or worse, a BMI over 40. And remember, once you have a BMI over 40, you have the same life expectancy as somebody that's been smoking a pack a day for the last 20 years. So it's significant. And so, you know, these are kind of the conversations that I have with patients when they've never considered surgery. It is not uncommon for patients, even if they have struggled all of their life with their weight. Maybe their entire family has been overweight. And they see surgery as a last resort, and I get that. Surgery's a big step. But, you know, if I have somebody that's coming to me and they're in their 30s or 40s and they've always struggled with their weight, they've probably been on every diet under the sun, I can tell you, with medication, the best that you're going to really get is you'll probably get down 30, maybe 40 pounds. And I think the other thing is that, I'm going to get this little bug. Hang on one second. I think the other thing is, you know, I want you to not just lose a lot of weight up front. I want you to keep that weight off. What all the studies also show, looking at medical weight loss, it has about a 98% recidivism rate. And what is recidivism? Repeat offender. That means typically when patients are doing medical weight loss, there's about a 2% success rate. So I don't care if my patients do medicine, if they do surgery, but ultimately what I want is I want them to lose weight. And if you have more than 30 to 40 pounds to lose, your body now has metabolic pathways that are not working correctly. How your body perceives fullness, how your body perceives hunger, how you utilize glucose, all of that is now kind of messed up. And that is why it is so incredibly difficult to lose a significant amount of weight. So, you know, my recommendation is always going to be surgery. Certainly if your BMI is over 35, but the newer recommendations now are if your BMI is over 30, I mean, yes, if you have a comorbidity, it can help, but if you've been struggling with your weight and you go to the little BMI calculator and you see your BMI is over 30, the very best chance that you have at losing a significant amount of weight and keeping that weight off in the long term is going to be with surgery, whether that surgery is a sleeve or a bypass or a duodenal switch. So I really just wanted to share that with you. I thought that it was high time that we had a really good, powerful study that certainly compared medicine to surgery, just a head-to-head test. You know, we're going to take the Pepsi challenge. We're going to see which one's better. And I think we find out what the answer is. 5 times the weight. I mean, who doesn't want to lose 5 times the weight? I mean, I know I would. So, hope that this helps, and share this with your friends.